Hello everyone, now let us discuss about 2023 CPT coding guidelines for surgery, musculoskeletal system part 8. In the current session, we will be focusing the CPTs in the range 2699902 to 27299. First of all, coming to pelvis and hip joint. In the current session, we will be discussing about pelvis and hip joint. The pelvis and hip joint is again categorized into incision, excision, introduction or removal, repair, revision and or reconstruction, fracture and or dislocation, manipulation, orthodesis, amputation and finally other procedures. The CPT range for incision is 26990 to 27036 and for excision it is 27040 to 27080 and for introduction or removal the CPT range is 27086 to 27096 and for repair, revision and or reconstruction the CPT range is 27097 to 27187. And for fracture and or dislocation, the CPT range is 27197 to 27269. And for manipulation, the CPT range is 27275. And for orthodesis, the CPT range is 27297 to 27296. And for amputation, the range is 27290 to 27295. And finally, other procedures, it has only one CPT. That is 27299. Coming to incision. For incision and drainage procedures, superficial, you need to refer 10040 to 10160. And coming here, the first CPT is 26990. Incision and drainage, pelvis or hip joint area, deep abscess or hematoma. The next is 26291. It deals with incision and drainage, pelvis or hip joint area, infected bursa. The next CPT is 26992. It deals with incision, bone cortex, pelvis and or hip joint. For example, to treat osteomyelitis or bone abscess. The next is 27000. It deals with tenotomy, adductor of hip, percutaneous. The next CPT is 27001. Tenotomy, adductor of hip open. And for bilateral procedure, to report bilateral procedure, report 27001 with modifier 50. The next is 27003. Tenotomy, adductor, subcutaneous open with obturator neurectomy. If tenectomy is combined with obturator neurectomy, the CPT is 27003. And to report bilateral procedure, report 27003 with modifier 50. The next is 27005. Tenotomy hip flexor open. It deals with flexor muscle. The next is 27006. Tenotomy abductors and or extensor of hip open. The next is 27025. It deals with fasciotomy, hip or thigh, any type. And to report bilateral procedure, report 27025 with modifier 50. The next is 27020. Decompression fasciotomies, pelvic compartments, example gluteus medius minimus, gluteus maximus, iliopsoas and or tensor fascia lata muscle. And it is a unilateral procedure. And to report bilateral procedure, report 27027 with modifier 50. The next is 27030. It deals with orthotomy hip with drainage. Orthotomy hip with drainage. That is example to treat an infection. The next is 27033. Orthotomy hip including exploration and or removal of loose or foreign body. The next is 27035. It deals with denervation, hip joint, intrapelvic or extrapelvic, intra-articular branches of sciatic, femoral or obturator nerves. And for obturator neurectomy, C 64763 to 64766. The next CPT is 27036. Capsulectomy or capsulotomy, hip with or without excision of heterotopic bone with release of hip flexor muscles. For example, gluteus medius, gluteus minimus, tensor fascia latae, rectus femoris, sartorius and iliopsoas. The next session is excision. For CPT is 27040. It deals with biopsy soft tissue of pelvis and hip area superficial. And for biopsy deep subfacial or intramuscular, you need to report 27041. And for needle biopsy of soft tissue, use 20206. The next CPT is 27047. Excision, tumor, soft tissue of pelvis and hip area, subcutaneous. Excision, tumor, soft tissue of pelvis and hip area, subcutaneous. Tumor must be subcutaneous and less than 3 centimeters. Then you can report 27043. If it is greater than 3 centimeters, you need to report 27043. Previously, it is 27047. Sorry. If the tumor size is less than 3 centimeters, the CPT is 27047. If it is 3 centimeters or greater, the CPT is 27043. And for excision of benign lesions of cutaneous origin, for example, sebaceous cyst, see the CPT is 114002 11406. The next CPT is 27048. It deals with excision, tumor, soft tissue of pelvis and hip area, subfacial. Previously it is subcutaneous, now it is subfacial. For example, intramuscular less than 5 centimeters. If it is greater than 5 centimeters or 5 centimeters, then you need to report 27045. Don't get confused. Here 27045 is out of numerical sequence. 48 greater number is given for less size and 45 is given for 5 centimeters or greater. Previously also there was certain discrepancy. Next CPT is 27049. It deals with radical resection of tumor. For example, sarcoma, soft tissue of pelvis and hip area less than 5 centimeters. And if it is greater than 5 centimeters or greater, the CPT is 27059. After 49 it is 59. This is also out of numerical sequence. Hence it is indicated by number sign. And for radical resection of tumor of cutaneous origin, you need to see 11600 to 11606. The next CPT is 27050. It deals with orthotomy with biopsy sacroiliac joint. And for orthotomy with biopsy hip joint, the CPT is 27052. And for orthotomy with synovectomy hip joint, the CPT is 27054. The next CPT is 27057. It deals with decompression fasciotomies, pelvic compartment with the debridement of non-viable muscle. And this is a unilateral procedure. And to report bilateral procedure, report 27057 with modifier 50. The next CPT is 27060. It deals with excision ischial bursa. The next is 27062. Excision trochanteric bursa or calcification. And for orthosynthesis or needling of bursa, use 20610. The next CPT is 27065. It deals with excision of bone cyst. 27065 deals with excision of bone cyst or benign tumor, wing of ilium, symphysis pubis or greater trochanter of femur, superficial, includes autograft when performed. The next is 27066. It deals with excision of bone cyst or benign tumor deep. It includes the autograft when performed. The next CPT is 27067. It deals with excision of bone cyst or benign tumor with autograft requiring separate incision. And the next is 27070. It deals with partial excision, wing of ilium, symphysis pubis or greater trochanter of femur. Superficial. If it is deep, the CPT is 27071. And for radical resection of tumor, previously it is partial excision. Now it is radical resection of tumor, wing of ilium, 1 pubis or ischial ramus or symphysis pubis. The CPT is 27070. The next CPT is 27076. It deals with radical resection. Radical resection of tumor. Here it is ilium including acetabulum, both pubic rami or ischium and acetabulum. If it is innominate bone, for the radical resection of tumor, innominate bone total, the CPT is 27077. And for radical resection of tumor, ischial tuberosity and greater trochanter of femur, the CPT is 27078. The next is 27080. It deals with cochleectomy primary. And for pressure ulcer, you need to refer 15920, 15922 and 15931 15958. Now let us see an example. A 85-year-old has developed a lump in her right groin. An incision over the lesion was made and dissected through the skin and subcutaneous tissue. Incision was made and it is dissected through the skin and subcutaneous tissue going deep into the femoral fascia. Sharp dissection of the mass was performed, freezing it from surrounding structures. 3 centimeters mass was isolated and excised. So here mass is excised and the size is less than 3 centimeters and it is deep, that is intramuscular. So the CPT is 27048. Excision, tumor of soft tissue of pelvis and hip area, subfascia, for example intramuscular, less than 5 centimeters. Here the tumor size is 3 centimeters. So it is less than 5 centimeters. So the appropriate CPT is 27048. The next session is introduction or removal. The first CPT is 27086. It deals with removal of foreign body, pelvis or hip, subcutaneous tissue. The next is 27087. It deals with removal of foreign body, pelvis or hip deep, that is subfascia or intramuscular. The next is 27090. It deals with removal of hip prosthesis and it is a separate procedure. The next is 27091. It deals with removal of hip prosthesis complicated, including total hip prosthesis, methyl acrylate with or without insertion of spacer. The next CPT is 27093. Deals with injection procedure for hip orthography without anesthesia. And for radiological supervision and interpretation, use 73525 and do not report 77002 in conjunction with 73525. The next is 27095. It deals with injection procedure for hip orthography with anesthesia. And here also for radiological supervision and interpretation, you need to use 73525 and do not report 77002 in conjunction with 73525. The next CPT is 27096. It deals with injection procedure for sacroiliac joint, anesthetic or steroid with image guidance. For example, fluoroscopy or CT, including orthography when performed. And 27096 to be used only with CT of or fluoroscopic imaging, confirming of extra-articular needle positioning. And if CT or fluoroscopic imaging is not performed, then you need to use 20552. And the code 27096 is a unilateral procedure, and for bilateral procedure, use modifier 50. Now let us see an example. A 45-year-old patient presents for the removal of left hip prosthesis. This is simple procedure. So the CPT is 27090 along with LT modifier to indicate left side, which deals with removal of hip prosthesis. Now coming to next session, that is repair, revision and or reconstruction. The first CPT is 27097. It deals with release or recession hamstring proximal. The next is 27098. It deals with transfer abductor to ischium. The next is 27100. It deals with transfer external oblique muscle to greater trochanter including facial or tendon extension. That is for graft. The next is 27105. It deals with transfer paraspinal muscle to hip. Includes facial or tendon extension graft. The next CPT is 27110. It deals with transfer iliopsoas to greater trochanter of femur. The next is 27111. It deals with transfer of iliopsoas to femoral neck. The next is 27120. It deals with acetabuloplasty. Example Whiteman, colonna, hay grooves or cup type. The next is 27122. It deals with acetabuloplasty resection with resection of femoral head. For example, Griddlestone procedure. The next CPT is 27125. It deals with hemi-orthoplasty hip partial. For example, femoral stem processes or bipolar orthoplasty. And for prosthetic replacement following fracture of the hip, use 27236. The next CPT is 27130. It deals with orthoplasty, acetabular and proximal femoral prosthetic replacement, total hip orthoplasty, with or without autograft or allograft. Previously it is hemi-orthoplasty, now it is orthoplasty, which includes total hip orthoplasty. The next is 27132. It deals with conversion of previous hip surgery to total hip orthoplasty with or without autograft or allograft. The next is 27134. It deals with revision of total hip orthoplasty, both components with or without autograft or allograft. The next is 27137. It deals with revision of total hip orthoplasty, acetabular component only. Previously it is both components, now it is acetabular component only with or without autograft or allograft. The next is 27138. It deals with revision of total hip orthoplasty, femoral component only with or without allograft. The next is 27140. It deals with osteotomy and transfer of greater trochanter of femur. The next CPT is 27146. It deals with osteotomy, iliac, acetabular or innominate bone. The next is 27147. It deals with osteotomy, iliac with open hip reduction. The next is 27151. It deals with osteotomy with the femoral osteotomy. The next is 27156. It deals with osteotomy with femoral osteotomy and with open hip reduction. The next is 27158. It deals with osteotomy pelvis bilateral. For example, for the correction of congenital malformation. The next is 27161. It deals with osteotomy femoral neck. It is a separate procedure. The next is 27165. It deals with osteotomy intratrochanteric or subtrochanteric, including internal or external fixation and or cast. The next is 27170. Bone graft femoral head, neck, intratrochanteric or subtrochanteric area, including obtaining the bone graft. The next is 27175. It deals with treatment of slipped femoral epiphysis by traction. Treatment of slipped femoral epiphysis by traction without reduction. The next CPT is 27176. It deals with treatment of slipped femoral epiphysis by single or multiple pinning in situ. The next is 27177. It deals with open treatment of slipped femoral epiphysis, single or multiple pinning or bone graft. And whenever bone graft is involved, it includes obtaining the graft. The next is 27178. It deals with open treatment of slipped femoral epiphysis with closed manipulation with single or multiple pinning. The next is 27179. It deals with open treatment of slipped femoral epiphysis with osteoplasty of femoral neck. For example, Heyman type procedure. The next CPT is 27181. It deals with open treatment of slipped femoral epiphysis with osteotomy and internal fixation. The next is 27185. It deals with epiphyseal arrest by epiphysiodesis or stapling greater trochanter of femur. The next is 27187. It deals with prophylactic treatment. For example, nailing, pinning, plating or wiring with or without methyl methacrylate, femoral neck and proximal femur. Now let us see an example. A 46-year-old patient presents for the revision of acetabular component. Revision of acetabular component of total hip arthroplasty. The laterality is right hip. So the CPT is 27137 along with RT modifier to indicate the right side. 27137 which deals with revision of total hip orthoplasty acetabular component only. Here it is acetabular component only with or without autograft or allograft. Coming to fracture and dislocation, the first CPT is 27197. It deals with closed treatment of posterior pelvic ring fractures. Posterior pelvic ring fracture, dislocation or diastasis or subluxation of ilium, sacroiliac joint and or sacrum with or without anterior pelvic ring fractures. This is a treatment for posterior pelvic ring fracture. It can be associated with or without anterior ring fracture. And to report the closed treatment of only anterior pelvic ring fracture and or dislocation of the pubic symphysis and or superior or inferior rami, unilateral or bilateral, you need to use appropriate T&M codes. This is important. If it is only anterior pelvic ring fracture and or dislocation, you need to use the appropriate T&M codes. And 27197 is for closed treatment of posterior pelvic ring fracture with or without anterior pelvic ring fracture or dislocation. Without manipulation. It is without manipulation. 27197 is without manipulation. If the procedure is done with manipulation requiring more than local anesthesia, for example, general anesthesia or moderate sedation or spinal epidural, then the CPT is 27198. In general, the fracture CPTs are categorized based on with manipulation and without manipulation, most of the cases. The next is 27200. It deals with closed treatment of coaxial fracture. The next is 27202. It deals with open treatment of coaxial fracture. The next is 27215. It deals with open treatment of iliac spine, tuberosity avulsion or iliac wing fracture unilateral for pelvic bone fracture patterns that do not disturb the pelvic ring, including internal fixation when performed. And to report bilateral procedure, report 27215 with modifier 50. The next CPT is 27216. It deals with percutaneous skeletal fixation of posterior pelvic bone fracture. Percutaneous skeletal fixation of posterior pelvic bone fracture and or dislocation for fracture patterns that disturb the pelvic ring. Unilateral includes ipsilateral ilium, sacroiliac joint and or sacrum. And to report a bilateral procedure, you need to append 50 modifier to 27216. And for percutaneous, minimally invasive orthodesis of sacroiliac joint without fracture and or dislocation, you need to use 27279. The next is 27217. It deals with open treatment of anterior pelvic bone fracture and or dislocation for fracture patterns that disturb the pelvic ring. Unilateral includes internal fixation when performed. It includes pubis symphysis and or ipsilateral superior and or inferior ramming. And to report a bilateral procedure, report 27217 with modifier 50. The next CPT is 27218. It deals with open treatment of posterior pelvic bone fracture. Previously, it is anterior pelvic bone fracture. So, 27218 deals with open treatment of posterior pelvic bone fracture and or dislocation for fracture patterns that disrupt the pelvic ring. Unilateral includes internal fixation when performed. It includes ipsilateral ilium, sacroiliac joint and or sacrum. And to report bilateral procedure, report 27218 with modifier 50. And for percutaneous, minimally invasive orthodesis of sacroiliac joint without fracture and or dislocation, you need to use 27279. The next CPT is 27220. It deals with closed treatment of acetabulum, hip socket fracture without manipulation. The next is 27222. It deals with closed treatment of acetabulum with manipulation with or without skeletal traction. The next CPT is 27226. It deals with open treatment of posterior or anterior acetabular wall fracture with internal fixation. The next is 27227. It deals with open treatment of acetabular fracture involving anterior or posterior column or a fracture running transversely across the acetabulum with internal fixation. The next is 27220. It deals with open treatment of acetabular fracture involving anterior or posterior. Previously it is one column, now it is two columns. Includes T fracture and both column fractures with complete articular detachment or single column or transverse fracture with associated acetabular wall fracture with internal fixation. The next is 27320. It deals with closed treatment of femoral fracture, proximal end, neck without manipulation. And if it is done with manipulation, with or without skeletal traction, the CPT is 27232. 27232. The next is 27235. It deals with percutaneous skeletal fixation of femoral fracture, proximal end, neck. The next is 27236. It deals with open treatment of femoral fracture, proximal end, neck, internal fixation or prosthetic replacement. All these things, they deal with proximal end, neck. Closed treatment is done with 27230 without manipulation. If closed treatment with manipulation, the CPT is 27232. And for percutaneous skeletal fixation, the CPT is 27235. And for open treatment of femoral fracture, proximal end, neck, the CPT is 27236. The next CPT is 27238. It deals with closed treatment of intertrochanteric or peritrochanteric or subtrochanteric femoral fracture without manipulation. If it is done with manipulation, with or without skin or skeletal traction, the CPT is 27240. And 27244 deals with treatment of intertrochanteric, peritrochanteric or subtrochanteric femoral fracture with plate or screw type implant with or without cerclage. And if it is done with intermediary implant with or without interlocking screws and or cerclage, The CPT is 27245. The next CPT is 27246. It deals with closed treatment of greater trochanteric fracture without manipulation. The next is 27248. It deals with open treatment of greater trochanteric fracture including internal fixation when performed. The next is 27250. It deals with closed treatment of hip dislocation, traumatic without anesthesia. If it is done with anesthesia, that is closed treatment of hip dislocation, traumatic requiring anesthesia, the CPT is 27252. The next is 27253. It deals with open treatment of hip dislocation, traumatic without internal fixation. The next is 27254. Open treatment of hip dislocation, traumatic with acetabular wall and femoral head fracture with or without internal or external fixation. And for the treatment of acetabular fracture alone with fixation, the CPT is 272262227. The next is 27256. It deals with treatment of spontaneous hip dislocation, developmental, including congenital or pathological. Treatment of spontaneous hip dislocation. Previously it is traumatic. Now it is spontaneous hip dislocation by abduction, splint or traction without anesthesia, without manipulation. The CPT is 27256. And if it is done with manipulation requiring anesthesia, the CPT is 27257. The next is 27258. It deals with open treatment of spontaneous hip dislocation, replacement of femoral head in acetabulum, including tenotomy. The CPT is 27258. The next is 27259. It deals with open treatment of spontaneous hip dislocation with the femoral shaft shortening. The next is 27265. It deals with closed treatment of post-hip orthoplasty dislocation. Closed treatment of post-hip orthoplasty dislocation without anesthesia. If it requires regional or general anesthesia, the CPT is 27266. The next is 27267. It deals with closed treatment of femoral fracture, proximal end head without manipulation. The next 27268 deals with closed treatment of femoral fracture, proximal end head with manipulation. The next is 27265. It deals with open treatment of femoral fracture, proximal end head, including internal fixation when performed. And do not report 27268 in conjunction with 27033 or 27253. Now let us see an example. A 35-year-old patient presents for closed treatment of right intertrochanteric femoral fracture without manipulation. So the CPT is 27238, which deals with closed treatment of intertrochanteric, peritrochanteric or subtrochanteric. Here it is intertrochanteric femoral fracture without manipulation. The next topic is manipulation. It has only one CPT. 27275. Manipulation hip joint requiring general anesthesia. Now coming to next topic, that is orthodesis. The code 27279 describes percutaneous orthodesis of sacroiliac joint using a minimally invasive technique to place an internal fixation device that passes through the ilium across the sacroiliac joint and into the sacrum, thus transfixing the sacroiliac joint. This is a minimally invasive procedure. And report 0775T for the percutaneous placement of an intra-articular stabilization device into the sacroiliac joint using a minimally invasive technique that does not transfix the sacroiliac joint. And for percutaneous orthodesis of sacroiliac joint utilizing both transfixation device and intra-articular implant. Then you need to code 27299 for percutaneous orthodesis of sacroiliac joint utilizing both a transfixation device and intra-articular implant. Then the CPT is 27299. The first CPT is 27279. It deals with orthodesis, sacroiliac joint, percutaneous or minimally invasive, indirect visualization with image guidance including obtaining bone graft when performed and placement of transfixing device. And do not report 27279 in conjunction with 0775P. And for percutaneous orthodesis of sacroiliac joint utilizing both a transfixation device and intra-articular implant, the CPT is 27299. And for percutaneous orthodesis of sacroiliac joint by intra-articular implant only, then you need to report 0775T. And for bilateral procedure, report 27279 with modifier 50. The next is a revised code. It is indicated by triangle 27280. It deals with orthodesis, sacroiliac joint, open, includes obtaining bone graft including instrumentation when performed. And do not report 27280 in conjunction with 0775T. And this point is same. The percutaneous or minimally invasive orthodesis of sacroiliac joint without fracture and or dislocation using a transfixing device. You need to report 27279. And to report bilateral procedure, report 27280 with modifier 50. The next CPT is 27282. It deals with orthodesis, symphysis pubis. This also includes obtaining the graft when performed. The next is 27284. It deals with orthodesis, hip joint. Next is 27286. It deals with orthodesis, hip joint with subtrochanteric osteotomy. By this we complete the orthodesis CPTs. The next topic is amputation. It has only two CPTs, 27290 and 27295. 27290 deals with interpelvic abdominal amputation, that is hind quanter amputation. The next CPT is 27295. It deals with disarticulation of hip. And finally, coming to other procedures, there is only one CPT, 27299. It is unlisted procedure, pelvic or hip joint. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.